Dear participants, let's start our afternoon session. So welcome back, and I would like to proceed now with our next agenda item. For these items, the relevant documents are going to be displayed on the screen. So it's a budget matters. So under this agenda item, the regional committee will consider the budget matters section of the top line accountability report and to be presented with the status of implementation of the program budget for the current biennium and the financial situation of the WHO Europe. In addition, it will be invited to consider the draft regional plan for implementation for the next biennium. Before moving forward with this agenda item, I would like to give the floor just a second, please. So I'd like to invite Ms. Corinne Capuano for the presentation. Over to you, Corinne.
Thank you very much, Mr. Chair, distinguished representatives. I am pleased to introduce Agenda Item 9 on budget matters, covering the WHO Program Budget 2022-2023 Results Report and the WHO Program Budget 2024-2025 in the context of the European Programme of Work 2020-2025 Regional Plan for Implementation. But before we discuss the program budget in numbers and percentages, I'd like to place a human face on what this is about, of how we strive to make a difference in the health and well-being of populations in our region. This is Dr. Anvar Nazurdinov, a national professional officer from our Tajikistan country office. Just a few weeks ago, Anvar was on a measles rubella vaccination campaign in the mountainous regions of Tajikistan, closely working with local primary healthcare providers to ensure children receive their immunizations, protecting them from potentially severe diseases. Behind numbers and percentages of the program budget, this is what we are talking about: the work we do with you and your teams, united in action for better health. Now, let's turn to the Program Budget 2022-2023 Results Report, document EUR/RC73/INF/9, which should be read in conjunction with the three resources indicated now on the screen. The report describes the progress towards delivering on the EPW, supported by the generous financial support WHO Europe received from an increasing number of donors, ensuring at the same time a clean balance sheet. Ultimately, this is about good and efficient management, the third main component of the regional directors' commitments to you, our member states. Reporting on technical progress covers the entire year 2022, while budgetary funding and implementation covers the first 18 months of the biennium. The report also highlights important lessons that we will apply towards PB 24-25. The base budget approved by the Health Assembly has grown steadily over time, with a particular bump between last and current biennia, as per World Health Assembly 75 decision to increase the budget as a result of the pandemic. Concerted efforts in resource mobilization also resulted in high levels of available funds, but not all these funds are flexible, and I will get back to this in a few slides. As of 30 June 2023, for the base segment, the implementation of 219 million was already close to the level of implementation at the end of last biennium. For the emergency segment, the implementation of 329 million had already surpassed the previous biennium by nearly 100 million. As of mid-October, our most recent figures show that in the last 3.5 months, so since our report in June, we have maintained the pace of implementation, reaching 260 million in the base segment and 372 million in the emergency segment. In summary, while we expanded support towards emergencies, we continued to deliver on our base program, ensuring a dual-track approach, thereby maintaining progress towards the implementation of the EPW. The growth WHO Europe experience in recent years could not have been possible without significant innovation in our business model, as discussed this morning. As mentioned earlier, while it appears there are sufficient funds available, the reality is that the majority of these funds are highly earmarked. Here is how each of the 4 strategic priorities are funded in the current biennium. In green, the fully flexible funds, the majority of which are assigned to enabling functions. For the other strategic priorities, we note significant shortfalls for strategic priority 2, emergencies, and strategic priority 3, health and well-being, and an overfunding for strategic priority 1, universal health coverage. Digging deeper, we see that not all outcomes are funded equally. While some areas are well funded, we still have pockets of poverty. Despite all efforts, only 30% of the base budget is funded from flexible funds. The remaining 70% comes from specified voluntary contribution, which hampers our ability to close these pockets of poverty. Equitable funding across outcomes is not possible without further increase in fully flexible funds. Of particular concern is the base segment of emergency preparedness and response. In PB 22-23, this concern was partially addressed through funds available in the emergency segment. However, in 24-25, a significant portion of this emergency segment funding will discontinue, placing delivery of strategic priority 2 potentially at risk. Let's keep these challenges in mind as we soon discuss financing of PB 24-25. Now moving to the Programme Budget 2024-2025 in the context of the European Programme of Work, Regional Plan for Implementation or RPI, document EUR/RC73/17. This RPI will cover the last biennium of the EPW and GPW 13. It reflects the priorities agreed with you, our member states, and lessons from PB 22-23. The RPI in front of us aims to further maximize the effectiveness and efficiency of WHO's operation while delivering measurable impact at country level. To begin, PB 24-25 will be a zero growth budget compared to the final programme budget 22-23. As you can see, 364 million is allocated for Euro, representing 7.3% of the global base budget. The distribution of budget space across outcomes reflects the priorities set by you, our member states, during the strategic planning process in the lead-up to the Health Assembly this year. Accordingly, 70% of the base segment is allocated to the top 10 priority outputs of the European region. Shortly, we will turn to how we aim and hope to fund PB 24-25, but first, allow me to provide a high-level overview of the technical side of the RPI. The RPI articulates the EPW priority work streams for the next biennium and unpacks both country and regional deliverables. It describes the programmatic areas under the respective strategic priorities and the enabling functions. It outlines what our collective achievements and success will look like and how WHO Europe will contribute to those results. Now, in terms of funding, there will be 2 notable changes. First, there will be a significant shift of budget and resources to country offices. Over the biennia, the split of resources between regional and country level has been shifting toward countries. The target for next biennium is close to parity with a 48% and 52% split. Secondly, the core predictable country presence initiative In this context, Euro will receive 10 million to establish a significant number of new staff positions in country offices. Furthermore, Euro will receive 13 million from the increase in assessed contributions decided at the last World Health Assembly. Most of these funds will be directed towards WHO's working country and in strengthening related enabling functions. Looking at this next biennium, we anticipate that 40% of the program budget will require concerted resource mobilization efforts to close the funding gap. But we are cautious about this outlook, considering global economic challenges. As we move towards the next biennium, we are also mindful of the increased accountability that the shift in budget implies for our country offices and the need to keep building capacity to ensure the efficient use of resources in compliance with financial rules and regulations. Finally, but importantly, the significant changes to our operations and the growth in our work has placed our staff under high level of strain. These pressures clearly require us to further focus on the health and well-being of our workforce. With this, we are looking forward to the next biennium with cautious optimism. This concludes the Secretariat presentation of item 9 on budget matters. Thank you, Mr. Chair.
Thank you very much, Dr. Karine Capuano. I would like to once again introduce Dr. Karine. She's the Executive Director in the Regional Directors Division. And I would like to take this opportunity, dear Karine, to warmly welcome you to Euro as a member of Dr. Hans Kluge's team. And thank you very much for the presentation. And then now I would like to invite our Regional Director, Dr. Hans Kluge, for his remarks. You have the floor, Dr. Hans.
Thank you, Dr. Marat. And I apologize for a minute late, as the Minister and me just finished the press conference. So, as I said on a numerous of occasions, we are fully committed to keep actively engaging the Member States and the governing bodies, including the SRC, in the program budget matters and ensuring the transparency, because we understand very well that transparency creates trust, and that's needed then to increase the share of the budget of the Member States to WHO. Last year, time was a bit short for the budget matters, and that's why, in line with our commitments, we put this on day 2, and I believe that this will give the ample time to have discussions and see where we can further improve. And I think, Mr. Chair, I will leave it maybe here and then reply a bit when I hear the comments and suggestions from the Member States.
Thank you very much, Dr. Hans. And now I would like to open the floor for any comments or remarks. So we will go as we usually do. We will first give the floor to Member States and international partners and non-state actors. So please raise your name tags if you wish to intervene at this time. I see Russian Federation. Please, you have the floor.
Уважаемый председатель, уважаемые коллеги, благодарим секретариат за подготовку этого документа. Доклад получился наглядным и достаточно подробным. Поддерживаем программные приоритеты, касающиеся модернизации здравоохранения, первичной медико-санитарной помощи, неинфекционных заболеваний и совместной разработки клинических рекомендаций. Разработка таких рекомендаций будет способствовать улучшению прогноза и качества жизни заболевших людей. И мы, несомненно, разделяем этот подход, тем более, что Россия была одним из инициаторов создания подобных руководств в рамках международной программы Country-wide Integrated Non-Communicable Disease Intervention. Тем не менее, совершенству не может быть предела, И призываем секретариат включать более детальную информацию о бюджете европейской программы работы в целях улучшения прозрачности. Хотели бы видеть, как именно планируется использовать финансовые ресурсы с точки зрения основных статей расходов, таких как персонал, командировки, оборудование. Региональный план исполнения представляется нам после утверждения программного бюджета ВОЗ. И, насколько мы знаем, именно после утверждения бюджета организации секретариат начинает детально планировать распределение средств, в том числе с точки зрения таких категорий, как расходы на персонал и командировки. Сейчас же мы видим распределение средств только через призму программных показателей, что заметно сужает наши возможности проанализировать адекватность планируемого использования финансовых ресурсов. Также считаем целесообразным включать в этот документ детально планируемое штатное расписание секретариата. Полагаем возможным сделать более осязаемые, закладываемые секретариатом показатели успеха программной деятельности. Мы имеем в виду части текста, которые поименованы, как будет выглядеть успех и как это будет достигнуто. Многие из разработанных секретариатом индикаторов достаточно трудно измерить или оценить с количественной точки зрения. Согласно лучшим практикам в системе управления, ориентированной на результаты, любая цель должна быть все-таки измеримой с указанием источников информации. Простой пример. Как можно понять, что прозрачность и подотчетность будет действительно улучшена к концу 2025 года? Вот об этом речь конкретно идет на странице 43. Поэтому рассчитываем, что в будущем секретариат сможет качественно усовершенствовать эту часть документа, сделав ее более конкретной там, где это возможно. Кроме того, мы обращаем внимание на то, что в документе не упомянута проблематика борьбы и противодействия мошенничеству. Руководящие органы ВОЗ неоднократно подчеркивали необходимость уделения должного внимания именно этой проблематике. Были бы признательны секретариату за пояснение. Благодарю за внимание.
Thank you very much, Russian Federation. And now I would like to give the floor to Turkey, following by Norway. I'm sorry, following by Slovakia. Sorry. Yep. So, Turkey, you have the floor.
Thank you, Chair. As can be seen on the funding of program budget 2022-23, 95% funding for the approved base segment is rather satisfactory. We welcome the progress made on the outputs reported in the 22-23 biennium. The unprecedented funding and implementation of emergency operations and appeal segment indicates that emergency operations are and will be a huge budget segment which actually can exceed the whole base budget. Resource mobilization success of WHO should therefore be appreciated. However, we also would like to stress the setback regarding the strategic priority 4, which has a lower level of programmatic implementation and reporting compared to the other strategic priorities. And taking in the fragility of the region against health emergencies, which can actually transform a chronic feature, it will be more rational and well-grounded if the Secretariat prepare following draft program budgets in line with this trend. We also call the regional office to do its best to make the base program implementation catch up the EOA implementation during the limited remaining part of the year. We welcome the larger allocation for country level in the PB 24-25 and WHO Europe's commitment to increasing country focus in the implementation plan. We hope these will yield concrete results for both EPW and country-specific priorities, thereby increase the region's contribution to global outputs. I thank you.
Thank you very much, Turkey. Now I would like to invite Slovakia, following by Norway. Slovakia, please, you have the floor.
Thank you, Chair. Slovakia would like to welcome both reports mentioned and presented in this segment. Also, great effort which was achieved on the governance matter in the region, especially about the role and objectives, and the need for more regional best practice implementation on both levels, the whole organization level, and also what is agreed on the governing bodies for example, EB plus PBAC decisions or recommendations. So it should be implemented and clearly implemented in our program of work. And I would like really to appreciate great improvement in this. On the other hand, we can be in this regard with this proposed program budget, but also specification of the priorities, great example for whole organization, which is vice versa, because as we see, this is drafted accordingly, according to the needs observed and defined in the region. And we can see that there are really improvements in comparison to the whole organization proposal for program budget and also program of work. So I would like to encourage all of us, member states, to be more involved in the work of PBAC, because I think that it's really great platform for delivering more impactful decisions on behalf of whole organization and providing more specific and strategic work. And on the last comment, I would like to turn the attention to the country offices and on the delivery on the countryside. We know that this is a priority, and also this is very good and very well described in the documents and the reports which are presented to us. But we would like to welcome more clear methodology on the framework, how the measurement of the achievements and outcomes will be done, and what kind of indicators will be measured related to specific priorities, and also approved decisions and resolutions for the implementation, if it is not just a piece of paper, but if we see also some impact on the country level with such a huge development and restructuring of the investment. Thank you very much.
Thank you very much, Slovakia. Now I would like to give the floor to Norway. Norway, would you like to still? Okay. Norway, following by Netherlands. So please, Norway, you have the floor.
Thank you, Chair. Regional Director, colleagues, we welcome the new strengthened approach to priority setting as an integral part of the development of the draft proposed program budget 2024-25. We support the overall approach in ensuring that the draft budget will be a better management tool and to ensure better allocation of funding. We would welcome more information of the risk and challenges in achieving the outcomes. We would also like to understand better how you work to address the challenges in securing sufficient funding for your programs in line with the strategic priorities. The needs and complexities of the euro is growing, and we acknowledge the need to ensure a business model of the euro that is fit for purpose. The complexity requires more control and oversight. More information on how you develop control and oversight mechanism is welcomed. Furthermore, with the increasing risk of misconduct in crisis situations like we have in Europe, we underline the need for a strong focus on prevention activities towards sexual exploitation, abuse and harassment, but also fraud. It is important ensuring a safe working environment as well as ensuring optimal use of funding and resources. The level of resources towards these efforts should be assessed regularly to ensure that they are fit for purpose. Finally, we welcome the increased focus and clear goals related to non-communicable diseases and mental health. Thank you.
Thank you very much, Norway. Now I would like to give the floor to Netherlands, following by United Kingdom. So Netherlands, please, you have the floor.
Thank you, Chair. I'll lower my flag. Thank you so much for the two reports and the presentation. under this agenda item. I think our points on budget matter can be very aligned with the statements we deliver for budget matters in headquarters. And we recognize the challenges and the great increase of spending for emergencies also on this level. And we don't expect them to go down soon, unfortunately. We commend how you have been able to be effective in your acquisition, but we recognize also the responsibility for member states in ensuring that Euro has enough flexible funding to be able to execute its operations. And that brings me to the few key factors that we see for matters of budgeting, which is flexibility of funding, which is for any organization the key to be able to implement its work. Priority setting, as was already mentioned, we support the approach to ensure better allocation of funding. And we have made a very important decision a few years ago as governing bodies to work with an outcome-driven budgeting, which means that we will be looking at WHO and their impact and outcomes of their work. This means that we will not be interested to, or we will not want to see you to seek approval on how you will be spending the budget exactly. We want to see the results of your impact, and we will expect accountability through proper auditing. We echo Slovakia's statement that the PBAC is indeed an interesting committee to follow, and Norway in ensuring that proper expenditure on enabling functions is indeed key, and we will be following also your work on that matter. Thank you so much.
Thank you very much, Netherlands. Now I would like to give the floor to United Kingdom, following by the Germany. So, United Kingdom, over to you.
Thank you very much, Chair, and I agree with a lot of the points that have just been made by previous speakers. It's really helpful to have these documents. Thank you, and thanks for making the time for this discussion. And I think the level of engagement here is showing you that that's very much appreciated. It's extremely helpful to have the numbers laid out for us, and you've illustrated very clearly the challenges of managing a budget where your sources of funding are constrained by specificity in many cases, and I think the more that we can understand that, the better the quality of the dialogue between us, so thank you for that. I just have one quick point and one question. Firstly, just to underline that I think Karim mentioned equitable funding across outcomes. That obviously isn't equal funding across outcomes. Some of the most impactful things may actually not be terribly expensive. So just, I'm sure that's your view too, but just to underline that what we're not looking for is a distribution across outcomes that just means everything's the same. And then secondly, the question, output 4.2.1 has quite a lot of resource assigned to it, but I wasn't completely clear from the description what those activities actually were. So if you could say a little bit more about that, that would be extremely helpful. Thank you.
Thank you very much, United Kingdom. And now I would like to give the floor to Germany. You have the floor.
Vielen Dank, Herr Vorsitzender. Sehr geehrte Kolleginnen und Kollegen. Deutschland begrüßt die erzielten Verbesserungen und Bemühungen in den Bereichen Management, Rechenschaftspflicht, Transparenz und finanzielle Nachhaltigkeit und dankt dem Regionalbüro dafür. Dazu gehört auch der gute Bericht und die guten Berichte, die heute vorgelegt wurden. Wir freuen uns, dass das Budget der Europäischen Region für die Jahre 2022 und 2023 im Vergleich zum letzten Zweijahreszeitraum um fast 1/3 gestiegen ist. Auch der Implementierungsstand des Haushalts hat sich im Vergleich verbessert. Wir begrüßen außerdem, dass ein größerer Teil der planbaren Ressourcen für die Stärkung der WO auf Länderebene eingesetzt werden soll, um die größte Wirkung bei der Verbesserung der Gesundheit und des Zugangs zu Gesundheit in der Region zu erzielen. Wir teilen ausdrücklich die Ansicht, dass eine nachhaltige und vorhersehbare Finanzierung des Basisbudgets dringend erforderlich ist, da wir seit Jahren die gleichen Finanzierungslücken sehen. Eine nachhaltige Finanzierung ist der Schlüssel für die Fähigkeit des Regionalbüros, dort etwas zu bewirken, wo es am dringendsten benötigt wird. Wir sind daher besorgt darüber, dass die Gesamtsituation der Finanzierung zwar positiv ist, es dem Finanzierungsmodell aber an Nachhaltigkeit mangelt. Die Zusammensetzung und Unvorhersehbarkeit der Finanzierung beeinträchtigt die Qualität der Arbeit des Regionalbüros. Ein erheblicher Teil der derzeitigen Finanzierung des Basissegments, etwa 2/3, ist zweckgebunden. Jetzt gebe ich im Grunde nur das wieder, was auch in den Berichten steht. Die Finanzierung des Regionalbüros für Europa hängt stark von einer kleinen Gruppe von Beitragszahlern ab. Die 10 größten Beitragszahler stellen zusammen 81% aller spezifizierten und thematischen freiwilligen Mittel zur Verfügung. Und die Top-3-Geber sogar stellen fast die Hälfte der Mittel. Wir sind besorgt angesichts dieser Abhängigkeit von wenigen Gebern. Daher, und das wird keine Überraschung sein, unterstützen wir die Umsetzung der Empfehlungen der WO-Arbeitsgruppe zur nachhaltigen Finanzierung und die Empfehlungen der Agile Member Task Group, insbesondere natürlich die Anhebung der Pflichtbeiträge. Wir fordern alle Mitgliedstaaten auf, ihre Beiträge nach Möglichkeit vollständig flexibel zu gestalten. Noch ein kleiner Ausflug in die Vergangenheit. In den letzten 10 bis 12 Jahren hat die WHO enorme Fortschritte gemacht in den Bereichen Transparenz und Rechenschaftspflicht. Infolgedessen ist aus unserer Sicht die WHO eine der am besten positionierten UN-Organisationen in Bezug auf finanzielle Transparenz. Dies wurde durch viele Bemühungen der Mitgliedstaaten erreicht, aber auch in Zusammenarbeit mit einem Sekretariat, das seinen Mitgliedstaaten zuhört und wesentlich zu dieser Entwicklung beigetragen hat. Daher möchten wir hiermit die Wertschätzung Deutschlands für die umfangreichen Bemühungen des Sekretariats zum Ausdruck bringen. Vielen Dank.
Thank you very much, Germany. So, are there any other member state who would like to contribute at this point? Well, and now I would like to invite our international partners, as there are no member states asking for the floor. So please raise your nameplate if you wish to speak. Yeah. There is no nameplates raised from our international partners. And as for the non-state actors, the Secretariat has not received any requests to take the floor. And now let me give the floor to Dr. Capuano to provide any responses.
Thank you very much, Mr. Chair, and thanks very much to all of your member states for your strong engagement. In this discussion, I mean, it's really very important to us to receive your guidance, and I've heard a lot of requests for more details. Thank you for your encouragement on the progress that has been made in the reporting, but we are also hearing that we have to do some more work to really fulfill our accountability and transparency. I will address some of these points together. So there was some comments on the needs to have more details as we move forward to the next program budget 24-25. As you know, the program budget is developed in mainly 2 stages: the strategic planning, which happened last year and led to the World Health Assembly, and the operational planning. We are now in the stage of developing on the operational planning stage, and I would like to inform our member states that there will be on 10 December a briefing on the operational planning by our headquarters. In the meantime, we are currently working full speed on both developing the workforce planning for the region, the country offices, but also for the activity work plan. So at this stage, it's still a work in progress as we move towards the next program budget. A number of you mentioned the base program and the emergency operation appeal segment. Both, as you have noticed, have seen a major increase in this current biennium. It's both for both segments. The base segment has increased by about 80 million and the emergency operation and appeal by much, much more. And as you know, this is earmarked to a specific crisis. So as some of you have mentioned, we anticipate that some of this funding will discontinue moving to the next biennium. So we don't have currently the visibility on what this segment will look like, but we are anticipating that it will decrease. This said, as I mentioned, it was linked to the capacity and the agility of the European region to respond to this crisis. Has come hand in hand by the business model that was discussed earlier this morning. And we have learned from these changes, and we are moving forward by implementing and institutionalizing some of these lessons as we move forward for the next biennium, using the business model and the change that we have seen this time. In terms of donors, yes, you have mentioned that we are relying on a few donors. However, if you look at the trends, actually, we have moved from 70 donors in the last biennium to 82 in the current biennium. So we are seeing an increase in in increasing our donor base. In the meantime, if you look at the shift between the top 5, top 10, top 3 contributors, you will see that it's also now a little bit decreasing, meaning that we are really increasing our base donor, but we are also improving the shift. It's still a work in progress, of course, and as we move forward, there will be, as you know, the investment rounds that we are working on, and we'll come back to that later today in the session. And so it's also a call for, as some of you have made, for more flexible funding and to keep the momentum for the sustainable financing and the need to increase our assessed contribution. I think there was some other very specific comments. There was some comments on what success will look like and how we are going to measure those success. Again, this is part of the operational planning and the work we are currently doing. So this is something that we are working on. But we are hearing you for the request for more details as we move forward, and we'll ensure that we provide these details for the next report. With this, we'll keep working on our transparency to continue to gain your trust and our accountability. So I think I will stop here. I think I've addressed most of the comments, but if I did not, I'm happy to try answer more. Thank you very much, Mr. Chair.
Thank you very much, Dr. Capuano. And now I'd like to ask Regional Director if you'd like to add some additional remarks.
Thank you, Professor Ranov. I would say that our joint success here depends on two main factors. The first one is the full availability of preferably flexible and predictable sustained funding of the program budget. And here, still only 1/3 is funded in such a manner in euro. Then we need to continuously monitor and improve the performance and focus on the results and the impact. And that's something that we're doing. Then the second point is to ensure the appropriate capacities within the Secretariat to optimize utilization of the funds. And this links back to the enabling hub in Istanbul. Because if, for example, there is an emergency, you receive big grants, big funds, you need to recruit. But it takes quite a bit of time to recruit. If you're already 6 to 8 months into the program implementation and the clock starts ticking, and you can recruit only in 6 or 8 months, you start with a huge disadvantage. That's why, again, this WHO enabling hub, I'm convinced, is going to help us, because as I mentioned yesterday, it allows us to recruit now fast track 32 more people in the business And then it's always a bit of a balance, because a lot of this funding I see anyway is not sustainable. You're not sure. So you need to implement, there's an emergency, you need to recruit, but you also need to be careful. If you want to attract good people, you need to be able to give at least, for example, a 2-year contract. But if you're not sure for the funding, so sometimes it's a bit of a catch-22, which I think we're managing quite fine, but I thought to give a little bit of this nuances. Having said that, there is one country office that I thought to mention here, which I had discussed with David Allen, our Director of Business Operations. I think he showed it this morning. It's the audit of the Ukraine country office. I mean, the country office in Ukraine is managing a huge amount of funding, I think almost 1/3 of the budget, 300 million, and the audit was fully clean with minimal findings, fully manageable. I think this was the first time in WHO for a country in wartime. So I'm telling this to express appreciation really to the WHO representative in Ukraine, to all the people in Ukraine who are also, I'm always holding my heart, I mean, working in very, very dangerous situations. Most of the time, if we have video conferences, they have to go and run to the shelter because, so in that sense, I think all the people in Ukraine, both WHO and the doctors and the nurses really deserve a lot of credit. Finally, a sustained increase in assessed contributions is really essential for the implementation of the regional plan of implementation for 24-25, along with careful operational planning. And there I'm also very committed. Actually, we have weekly meetings now with Corinne, David and me. You know, I got to know that a regional director has 3 arms. Actually, I thought I have 2 arms, but I got to know it's the first job that I'm having without job description. So little by little you learn. It's a very complicated job. So I have 3 arms. There is a political arm, there is a strategic arm, and then there is the whole governance and budget. And I'm very happy to hear from your appreciation that we put a lot of effort now, since Tel Aviv last year, to the 3rd arm. And also internally, this is very helpful, because David has a big portfolio on the 3rd arm, and Corinne, and again, I also want to welcome you, Corinne, to the team, is really a great experience that you bring with you, having been DPM, Director of Program Management, and also Chief of Cabinet of a RD in another region to us. And that brings even more complementarity in our team. But we are very committed to further move from good to great. Thank you.
Thank you very much, Dr. Kluge, for your remarks. And I would like to now to ensure that all your valuable remarks, which was made by member states, will be noted at the meeting report. And we are looking forward to see all these important developments. And with this, I then close this agenda item.